Do you need a real surgery or a fake one? Imagine you're suffering from constant knee pain. Walking hurts. Stairs hurt. Getting out of bed hurts. You've tried medication, physiotherapy, injections. Nothing works. Then a surgeon tells you there's one final option: surgery. You agree. You go to hospital. You are wheeled into the operating theater. You are put under anesthesia. The surgeon makes an incision. You wake up believing your knee has been repaired, and within months, your pain improves. There's just one problem. The surgeon never actually fixed anything. In fact, the surgeon didn't perform the operation at all, and yet you got better. This sounds impossible, but it happened, and what scientists discovered next would challenge one of medicine's deepest assumptions. Our story begins in the 1990s. At the time, thousands of people suffering from knee arthritis were undergoing a common surgical procedure. The logic seemed simple. Patients had damaged cartilage inside their knees. Surgeons would clean out the joint, flush away debris, and smooth rough surfaces. The operation became incredibly popular. Doctors believed it worked. Patients believed it worked. Insurance companies paid for it. Everyone assumed the science was settled. But one orthopedic surgeon had a troubling question. What if the surgery wasn't actually helping? What if patients were improving for another reason entirely? It was a dangerous question. This procedure was performed on hundreds of thousands of people. Questioning it meant challenging an entire medical system. Most importantly, what if he was wrong? Yet science demands something difficult. Sometimes we must test our strongest beliefs. So the surgeon assembled a research team. They designed one of the most controversial experiments in modern medicine. Patients would be randomly divided into groups. Some would receive the real surgery. Others would receive a fake surgery. Not a fake diagnosis, not a fake consultation, a fake operation. The patients would be anesthetized. The surgeons would make incisions. The operating room would look exactly the same. Everything would happen exactly as expected, except the surgical repair itself. Nothing would actually be done. The patients wouldn't know which group they were in. Neither would many of the people evaluating them afterward. The stage was set. Now all they had to do was wait. Months passed. Researchers collected data, pain scores, mobility scores, quality of life scores. Then came the moment of truth. The team opened the results. What they found stunned them. Patients who received the fake surgery improved. Not a little, a lot. In some cases, they improved just as much as patients who received the real operation. Think about that. People experienced less pain, better movement, improved quality of life after a surgery that never actually happened. How could this be possible? Had the patients imagined their improvement? No. The changes were real. The pain reduction was real. The improved function was real. What scientists realized was that the human brain plays a much larger role in healing than anyone had appreciated. When patients believed they were receiving a powerful treatment, the brain responded. Expectations changed biology. Neural pathways changed. Pain processing changed. The body's own chemistry changed. The treatment itself wasn't always the entire story. The patient's belief in the treatment was part of the story too. This phenomenon became known as the placebo effect, but researchers began to see it differently. The placebo effect wasn't fake healing. It was real healing, triggered through unexpected pathways. The implications were enormous. If some surgeries worked no better than placebo procedures, how many medical treatments needed re-examination? How many accepted practices were based on assumptions rather than evidence? And perhaps most fascinating of all, what hidden healing powers exist inside the human brain? Today, placebo-controlled trials are considered one of the most important tools in medical research. Not because scientists want to prove treatments don't work, but because they want to know which treatments truly work. The fake surgery study reminded the scientific world of something profound. Sometimes the greatest discoveries happen when we question what everybody already believes. And perhaps the most surprising lesson wasn't about surgery at all. It was about the incredible connection between mind and body, a connection we are still trying to understand. Because if belief alone can influence healing, What else might the human brain be capable of? And that is a mystery science is still trying to solve.